I'm sitting here today with Dr. Paul Mittman. And Paul, you came to me just under 2 years ago, and you were having quite a bit of low back pain, which I'm going to let you describe. And we determined that you had two things going on. You had a desiccated L5-S1 disc, and you also had an anterior listhesis at that level. And then you had a protrusion and herniation at the L3, L4 level, I believe. And we injected bone marrow stem cells into your L5-S1 disc. We did a transforaminal epidural at the L3, L4 level. And we also did sort of a traditional prolotherapy perifacet ligament injections with bone marrow stem cells. And please tell me what a little bit of the story of what your pain was like and how you're doing now.
Sure, my pleasure. I actually experienced low back pain for about 40 years. You mentioned the spondylolisthesis. That was first diagnosed when I was 19 years old. And so I had chronic low back pain punctuated by episodes of severe low back pain during that time. This particular problem started about 4 months before seeing you. And it was after lifting a piece of furniture, and I felt a pop in my back and experienced pain, you mentioned, in two regions. And so one of them was this boring, gnawing pain right in my low back, in my lumbar lumbosacral area. Everything was on the left, and it would radiate around into the groin. And then the second was a numbness slash paresthesia in the upper lateral thigh. It got, at first it was that I just couldn't sit at all. Ate standing up, had meetings standing up. I remember having Thanksgiving dinner standing up. And then it got so bad that I couldn't walk either. And so it got to the point where I had to lie down at least once an hour. And so at that point, I was really pretty debilitated. It was hard to go to work. I couldn't exercise. I couldn't ride my bicycle. Couldn't drive in the car. It was very, very limiting. I would say on a scale of 1 to 10, for me, this was a 9, almost all the time.
And then we did the treatment.
Oh yeah, we did the treatment, and it was interesting. I remember to the day. It was a Wednesday afternoon. Started at 3 p.m. We were done at 5 p.m. Flew back the next day, and Friday morning I went to work. And sat through, everybody was kind of astounded because I was sitting through meetings. I was still all bandaged up. Sat through meetings, got there about 8:30 in the morning, worked till about 6 p.m. at night. It was probably about 75% better within that 48 hours. And then it progressively improved over the next few weeks to the point where I don't really have much, I haven't had any acute episodes. I've hardly gone and gotten manipulation or anything like that. In the ensuing 2 years, and I would say the level of just kind of chronic back pain is pretty minimal also. So you're talking to a pretty happy kid.
That's outstanding. I'm thrilled for you. That's great. So if you had to pick a percentage improvement overall, what would you say you had?
Right. Well, I would say for the acute problem that was going on at the time, 100%. And I would say my back feels stronger, and I'm very careful now, but I feel like I'm less susceptible than I was, so maybe 90% better for the chronic.
That's great. I'm thrilled for you. That's terrific.
Me too.
Great. Thanks so much.
Yeah, thank you.